Hello everyone, my name is Golden and today I'll be doing my presentation over infectious mononucleosis. And first up, we'll be talking about signs and symptoms. Signs and symptoms may vary when people have mononucleosis. People with them may notice that they have fatigue, a fever, may have swollen tonsils, may even have headaches, skin rashes, soft swollen spleens, swollen lymph nodes in the neck or armpits, and sore throats is often misdiagnosed as strep throat, which doesn't get any better after treatment with antibiotics. So as you can see, this disease causes a disruption to usually where your lymph nodes sit. And here I have some pictures to kind of give you an idea of what it does to the body. As you can see to the image to the left, we have someone's throat here. You can see in their tonsil area that you see this white substance growing on the surface of them, and that can be a sign of the mononucleosis that that someone may have. And to the right here, you see that the patient's neck is swollen, which is where a lymph node lies, as previously stated. And then the last image at the top, you see that this doctor or nurse is checking on the patients to see if their lymph nodes is swollen or if they feel any type of um, something that just feels quite odd in that neck area. This is typically what he's checking for. And then causative agents of infection. Infectious mononucleosis is also known as mono and has Epstein-Barr virus, which is also known as EBV, which is the most common cause of this disease. It can also cause other types of diseases as well, but this is what usually is the outcome of EBV. It is also a lot more common in young adults, teenagers, and especially college students, mainly because this is the age where people, children are more social and they go out more, they go to parties, they go to bars, they're talking to people and, things of that nature. And then we can't forget about kissing. Hormonal things are going on. So that plays an effect as well. And now to talk about pathogenesis. Oh man, I struggle pronouncing that. One of the main factors is its ability to stay latent for as long as it does. This virus even has the ability to fuse with cells, almost engulfing it in its entirety, which is basically just disrupting and killing cells overall. For example, this disease, hemophilia, and it can be inherited. Its main virulence factor is disrupting the body's clotting factor, which is extremely life-threatening. And to diagnosis of infection. In order to be diagnosed, your blood can be tested to rule out other diseases, which usually helps doctors to know, okay, if they know it's not these other diseases, then it allows them to hone in on what actually is the cause of the disease. You may also see swollen lymph nodes, tonsils, liver, and spleen on someone with this infection. Some are seen with the naked eye and also others not so much. There's also testing called monospot testing, which is basically a blood test used to see if Epstein-Barr virus is present. That virus, if present, will be attacking certain blood cells, sometimes causing symptoms that may seem like the flu. Once your blood is under the microscope, it is then mixed with other substances. While being mixed, if there's no clumping, then mononucleosis virus is not present. But however, if there is clumping, seen in the microscope, then the patient has the EBV virus. Ways of transmission and the epidemiological data. This is often called the kiss of disease, mainly because it's transferred on the basis of mixing saliva or transferring saliva from one person to another. Yet, it could be transmitted through sharing a glass, sharing food with someone who already possesses mono. Prevention and treatment. To To prevent this disease is very simple. Simply no kissing or doing anything that could possibly allow you to swap saliva with another person, which goes back to why this disease is more common with college students and young adults. This age group is very fond of getting themselves in situations where saliva is being transferred from one to another. As for treatment, nothing special besides antibiotics and just not sharing drinks with someone or transferring saliva with someone else. And that is all for my presentation. Thank you so much.